Namaste. Welcome to all to yet another session of Gurukula episode 28. So, welcome to all our participants of Easy Ayurveda family to this particular session. So, today we have Dr. Saujanya J with us she'll be presenting her topic as an extended version of her presentations on Vata Vyadhi. So that's the topic she has been taking as a series, and this is an addition to that particular series, one more episode from Dr. Saujanya. So on behalf of all of us and Easy Ayurveda, may I take the privilege of cordially welcoming Dr. Saujanya to this session of Gurukula. Welcome and namaste, Dr. Saujanya.
Namaste, sir. Thank you.
Namaste. So before letting it to Dr. Saujanya to take it over from here, I would like to give a brief introduction. So Dr. Saujanya J, a very passionate person about Ayurveda. As a doctor, as a human being, she has been rendering wonderful service at the clinical level and also at the academical level. A good teacher, a good practitioner. Apart from degree in Ayurveda, BAMS, and also post-graduation degree in Kai Chikitsa, she is also pursuing her PhD and has a degree in MA Sanskrit. So, working as assistant professor at the Department of Kai Chikitsa, SDM Ayurveda College, Bangalore, has many awards to her name, including International Best Research Scholar Award, the Real Superwoman Award, Rashtriya Ratna Samman Award, and iconic researcher as well. Young Research Award for publication, a bird's eye view in incorporating Ayurveda principles and treatment, the management of tennis elbow, has been in various roles, including a guest speaker and a resource person at various stages, has published many articles and given many presentations in seminars and conferences. Today, Dr. Saujanya will be presenting us with a very interesting topic again from the Vata Vyadhi series, an analytical interpretation of Gata Vata. So that will be the topic of presentation today. So without wasting any time, so I would like to hand out this to Dr. Saujanya. Dr. Saujanya.
Thank you, sir. Yeah. Good evening, all. Today, moving to topic an analytical interpretation of Gata Vata as a continuation series. So, moving into introduction. The Gata Vata are defined as Sthana Vishesha Vata Vyadhi. Vata Vyadhi based on sites of manifestation. The pathophysiology can be interpreted as I had already been explained the different Nidana Sevana for Vata Vyadhi such as Ruksha, Shita, Alpa, Laghvana, Vyavayati, Prajagaraihi and all. Just brushing up those things, if anyone indulges in these etiological factors leading to Vata Dosha Prakopa, that is Vata Dosha which gets vitiation, and it affects a particular site of the body where there is Kavaigunya, that is the sites which are prone to get diseased manifesting Gata Vata. For example, as I said, Ruksha Shitalpa Laghvana had given many examples of how Vata Dosha gets vitiated if a person indulges in prolonged and excessive use of, for example, if we take gobi manchuri followed by carbonated drinks, it affects the pittasthana, especially the amashaya, where the amashaya becomes prone and the vata which is vitiated will lodges in amashaya, leading to Amashayagata Vata. This is one example where the vata will just affect the site which is prone to get the diseased one. So moving into different Gata Vatas, it can be divided into three aspects as Ashayagata Vata, Dhatugata Vata and Upadhathugata Vata, and finally Sarvanga Gata Vata. So Ashayagata Vata are vitiated Vata affecting particular organ or organ system, which can be divided into five major aspects such as Koshtagata Vata, where vitiated Vata dosha affects entire abdominal region and a part of trunk. Amashayagata Vata, vitiated Vata affecting stomach and nearby organs. Pakwashayagata Vata, vitiated Vata affecting small and large intestine. Gudagata Vata, vitiated Vata affecting sigmoid colon, rectum and anus. And at last, Indriyagata Vata, vitiated Vata affecting sense organs. The next set of Gata Vata is attributed to Dhatugata Vata, whereas the vitiated Vata affecting the particular tissues will be divided into seven, that is Saptadhatus, Dvagata, Raktagata, Mamsadhatugata, Medadhatugata, Asthi, Majja, and Shukradhatugata. Here, individual tissue will be getting affected by means of vitiated vata, which starts from blood or plasma or lymph, blood tissue, muscle tissue, adipose or fat, bone tissue, bone marrow, and entire reproductive system. This is about Dhatugata Vata. Next is Upadhathugata Vata, where vitiated vata affects specific Upadhatu, which is a subordinate of the tissues. So, such as Siragata, Snayugata, and Sandhigata Vata. Siragata Vata, where vitiated vata affects the specific vessels. Snayugata affects the connective tissues, which can be considered as ligaments, tendons, or nerve. And Sandhigata Vata, which affects the skeletal system, including the joints. And the major one is Sarvanga Gata Vata or Sarvanga Vata, where the Vata dosha affects an entire human body or entire body. So here the Gatavata concept is mainly attributed based on the functional disturbances in the body rather than the anatomical disturbances. So I'll be taking up initially the Ashaya Gatavata, that the 5 Ashayagata, their signs and symptoms, what may be the treatment to be planned, and how we can interpret it clinically in today's session. So, moving into the first one, Koshtagata Vata. So, here the vitiated Vata affects the entire abdominal region and lower part of the trunk. The signs and symptoms, that is, Lakshana, goes like Tatra Kosthashtite Dushte, Nigraho Mutra Varchasoho, Bradhana Hridroga Gulmarshaha, Pashvashulam cha Marute. Acharya Charaka has beautifully taken up the concept of Gatavata and how the functional disturbances in our body can be clinically treated has been very beautifully explained. So the signs and symptoms are as follows. As the symptomatology or pathophysiology goes like Nidana Sevana, that is etiological factors, Sthana Samshaya of Vata, that is vitiated Vata, moves from its Sthana to Koshta Pradesha, that is entire abdominal region or part of the trunk, leading to Nigraho Mutra Varchasoho, that is retention of urine and feces, Bhradna, swelling in the Vankshana Pradesha, especially the groin region, Hridroga, cardiac elements and other associated elements leading to epigastric and intestinal discomforts. Then various kinds of abdominal inflammatory conditions, swellings, lumps and tumors can be attributed to Gulma, Asha, hemorrhoids, and at last Shulam, that is pain in axillary region or rib cage or flank, especially Pashvashulaha. So why only these symptoms can be attributed to Koshtagata Vata can be understood only if we understand the types of Vata. In our classics, there has been explanation regarding Panchavata. There are 5 types of Vata dosha, which are Pranavata, Udanavata, Samanavata, Vyanavata, and Apanavata. So we have to understand individual site of the Vata and functions of individual Vata so that we can understand the functional disturbances of Gata Vatas individually. So moving into first one, that is Pranavata, Prano Atra Murdhagaha, Uraha Kanthachara Buddhihi, Hridayendriya Chittadhrak, Shthivana Kshavatudgara, Nishvasa Anna Praveshakrit. So it is a type of Vata dosha which is resides on head, neck, and trunk and which circulates all over there and mainly have functional capacity to maintain the intellectual of a person, which manages the functions of heart and associated structures, sense organs, psychological functioning, controlling the mind, and aids many mechanisms such as spitting, sneezing, belching, respiration, and even the food intake responses. So, complete responses of all these aspects or all these mechanisms will be aided by Pranavata. Next is Udanavata. So here Udanavata represents Urasthanam Udanasya Nasa Nabhi Galams Charit Vak Pravrittihi Prayatna Urja Balavarna Smritikriyaha. So it is a type of Vata which is attributed to nose, throat, trunk and abdomen, which mainly aids in speech coordination, initiating the responses, maintaining energy levels, strength and complexion, and memory responses. The next Vata being Vyanavata. व्यानो हृदस्थितः कृत्स्नदेहचारी महाजवः गत्यपक्षेपणोक्षेप निमेषोन्मेषणादिकाः प्रायः सर्वाः क्रियाः तस्मिन् प्रतिबद्धाः शरीरिणम्. So it is present mainly in trunk and all over the body and which is responsible for all kinds of motor and sensory functions as different stages like different kinds of movements pertaining to limbs, closure and opening of eyes, and so on. Next is Samanavata. Samano Agni Samipastaha Koshthe charati sarvataha annam grinhati pachati vivechayati munchati. The main site is abdomen, where entire digestion function and metabolism will be attributed to Samana Vata. And the final one is Apana Vata. Apano apanagaha shroni basti medra urugocharaha shukra arthava shakran mutra garbha nishkramana kriyaha. So the main site is lower abdomen, urogenitals and reproductive organs, which aids at mainly reproductive functions and urogenital functions. So after understanding all these things, Koshtagata Vata signs and symptoms can be interpreted as, here in case of Koshtagata Vata, there is Panchavata Vaigunyata due to Vimarga Gamana, that is, each Vata should have its specific channels to more specific gati in the body. A specific pathway will be there. If that pathway is trespassed and it reaches inappropriate pathway, it affects the vata dosha in different aspect called as vimarga gamana, leading to all the signs and symptoms which has been explained. Specifically, mutra varcha nigraha and arshas due to apana vata vaigunya, bhradna gulma and parshvashula due to samana vata and vyana vata along with apana vata vaigunya, hridroga prana and vyana vata vaigunya. And as I explained before in my Samprapti sessions, there are two kinds of Sampraptas in Vata dosha or Vata Vyadi, that is Dhatukshayajanya Samprapti and Margavarodhajanya Samprapti. Here in Koshtagata Vata, both Sampraptas plays an equal role. Even the concept of avarana, that is one subtype of Vata obstructing the other type, leading to the obstruction and moving in an inappropriate pathway, that is the vata dosha alone is a culprit here, leading to Koshtagata Vata. So in this condition, the line of treatment goes like Visheshatastu Koshtaste Vate Ksharam Piben Naraha Pachanair Deepanaireva Yuktairva Amlairva Pachayen Malan. So the main concept here, the Koshtha is mainly the Agnisthana and specifically Nabhi stanantarayoho yonirmadhyah iti koshtaha. The complete region which can be considered from the lower part of the trunk and abdomen comes as a part of koshta here. Entire abdominal region, entire organ systems will be affecting, where mainly Agni will be hampered here. So the first line of treatment should be planned thinking about Pachana and Deepana. Specifically, Kshara has been taken as an example by Acharya Chakrapani, considering Evakshara Prayoga. Other Ksharas and clinically can be of Shivakshara Pachana Churna, Shankhabhasma Prayoga, Shankhavati Prayoga, and for Deepana Pachana, Chitrakadivati, Hingvadivati, Hingvashtaka Churna, Shankhavati, based on different stages and different signs and symptoms a patient exhibits can be planned. And specifically, a question says that Deepana Pachana with Amla Dravya Prayoga, such as Hingvashtaka Churna plus Matulunga Swarasa and Krita Mishrita Anna. Krita here is ghee. So we can consider a normal practice of ghee mixed with rice. Along with that, Hingvashtaka Churna and Matulunga, which is best in Koshtagata Vata. And to be a very interesting part, one of the acharyas mentions Kshira Prayoga, which has been emphasized instead of Shara Prayoga in Koshtagata Vata, where we can interpret this as Deepana Pachana Yukta Samskarita Kshirapana, such as Panchakola Siddha Kshirapana, Shunti Kshirapana can be advised in case of Koshtagata Vata. The next is Amashayagata Vata. Here, the vitiated Vata affects stomach and nearby organs, and signs and symptoms goes like हृन् नाभि पार्श्व उदर तृष्ण उद्गार विसूचिकाः कासः कण्ठास्य शोषश्च श्वासश्चामाशयस्थते. So again, due to many causative factors which has been explained, the vitiated vata goes and affects specifically the stomach and nearby organs, leading to pain in cardiac region, epigastric region, umbilical region, flanks, and entire abdominal plane, along with thirst, belching, different kinds of pain such as pricking, piercing, twitching, along with diarrhea and vomiting. So, along with all these abdominal features, there may be cough, dryness of throat, and mouth dryness, along with difficulty in breathing in case of Amashayagata Vata. Why these specific signs and symptoms in Amashayagata Vata can be interpreted as Hrinnabi Parshva Udararuk. The ruja or pain has been very specifically set to Hrit, that is cardiac region and associated Nabhi umbilical region, Parshva flanks, and such on. Why it is so? One can interpret this as all these have been originated by means of Matruja Bhava. So while explaining Garbha Sharir or embryonic stages, different organs have been given different bhavas such as Matruja Bhava, Pitruja Bhava, and so on. So here all these organs which has been explained where there is specific pain are attributed to Matruja Bhava, and mainly second is Kafasthana. The Kapha is a dosha which have specific site in the body which is attributed as Uraha Kanta Shira Klomo Parvanyama Shayorasaha. So all these organs or structures are involved in the Kafasthana. Next is Annavaha Sroto Mula. Amashaya being Annavaha Sroto Mula can be considered here. And all these organs are mainly composed of Rakta and Kapha. So specifically Ruja may be elicited in patients in these organs. Next is Trishna. Why Trishna? So Amashaya is predominantly Kafasthana. So as I said, the etiological features such as Rukshadi Guna Vriddhi. So this Vata, which is Ruksha in nature, enters the Amashaya. Thus dryness of the Kapha, that is Shoshana of Kapha, which is present in Amashaya and near Sthana, which does Pitta Prakopa leading to Trishna. Next, Udgara. Again, as I said, when the Vata here should have a normal Gati which leaves its path and attends other path and leads to impairment in Gati of Vata leading to Udgara, that is belching. So Visuchika can be interpreted in two ways. One is Prakupita Vata amalgamates with Ama, that is Ama dosha, and Prakupita Kapha dosha in Amashya leading to Visuchika. And next is Avaranajanya Samprapti, as I already been explained. The last set of signs and symptoms such as Kasa, Kanthasya Shosha, Shwasa, mainly here, as I said, the Kafasthana should not be forgotten at any moment. Amashaya and Urus. Again, Vata Prakopa, Sthana Samshaya to Kafasthana leading to Kasa, Kanthasya Shosha and Shwasadi Samprapti. So here the entire stomach and related organs have been functionally disturbed. So one has to plan amashayasthe shuddhasya yata dosha hari kriyaha. So dosha hara kriya here refers to based on involvement of dosha. If there is vata kapha pradhanya, one has to plan vamana, that is emesis. If there is vata pitta pradhanya, or we want vata to attain its normal gati or anulomana gati, one has to plan for virechana. And specifically, Sushrutacharya quotes that after Vamana, Shadharana Yoga Prayoga should be done with Ushna Jala for 7 days, which consists of again Deepana Pachana and Amahara Yoga. And Ashtanga Hridayakara gives other prayogas such as Vachadi Prayoga. And always we have to remember that once the Shodhana has been done, Samsarjana Krama is very, very important to maintain proper metabolism. That has to be always taken care. After that, again, if you want to plan chikitsa or if you want to continue the treatment, one can adopt the Samanya Vatavyadi Chikitsa, which I had already dealt in my previous sessions. So Bhava Prakashakara gives specifications regarding this diet plan. Initially, we have to go with Lankhana Pachana, then Vamana or Tikshna Varechana based on dosha involvement. Green gram, barley, that is Mudga, Yava, and Purana Shali has been specified for Samsarjana Krama by means of Bhava Prakashacharya because they are Vata Hara, and again which does the Agni Sandukshana, which brings back the digestive power and metabolism in our body. This is about Amashayagata Vata. Next is Pakwashayagata Vata, where vitiated Vata affects small intestine and large intestine. The signs and symptoms goes like Pakwashayastho Antrakujam Shula Atopau Karoticha Kritra Mutra Purishatvam Anaham Trikavedanam. So again, various intestinal disturbances, the vitiated vata goes and affects specifically the Pakwashaya, leading to intestinal disturbances, different kinds of pain such as colicky pain, distension of abdomen followed by gurgling sound, again difficulty in defecation and urination, distension of abdomen, along with passage of flatus and lumbar sacroiliac pain. So specifically Pakwashaya has been contributed as Adharaguda by Chakrapani Acharya, which is interpreted as small intestine and large intestine up to the sigmoid colon. So here mainly Apanavata Vaigunya is seen, and Sangha and Vimargagamana Samprapti of Vata can be easily elicited. So for this, the line or Chikitsa has been emphasized as Guda Pakwashayasthetu Karma Udavarta Nudhitam Pakwashayagate chapi deyam sneha virechanam bastayah shodhaniyascha prashascha lavanottaraha. So the mainly Udavarta hara kriya should be done. Udavarta is again a different functional abnormality of Vata dosha that can be taken up in next any other further sessions. So here we have to understand the same line of treatment which has been told in Udavarta, a condition where mainly the functional aspect of Vata will be hampered because the Vata dosha leaves its pathway and moves in opposite pathway or other pathway. So that can be understood for right now. Similar pathophysiology happens in Pakwashayagata Vata. So the same line of treatment which has been explained for Udavarta, such as Vedana, Varti Prayoga, that is suppositories, medicated ones, and Basti Prayoga, enema therapy can be taken up here also. And Sushrutacharya specifies Sneha Vrechana, it can be Tilvaka Sarpa Yuddha Sneha, and clinically we can operate Gandharva Hastadi Erenda Taila, Nimbamritadi Erenda Taila, and so on. And Shodhaniya Basti, we can take an example of Erenda Muladi Niruha Basti or Dashamuladi Niruha Basti based on approach of the patient and what phase the patient has approached us. And Lavanottara Prasha is one more specification which has been given here, and Dalhanacharya say it is Sneha Lavana. And for Vanhi Samvardhana, again, wherever the functional abnormalities of Vata is there, where abdomen, intestine, stomach has been involved, we should not leave Agni. The metabolism should be always maintained. For that, Hingvashtaka Churna can be taken up. Next, moving into fourth one, that is Gudagata Vata. Here the vitiated Vata mainly affects sigmoid colon, rectum and anus, and signs and symptoms goes like Graho Vindmutra Vatanam Shula Admana Ashma Sharkaraha Janghoru Trika Path Prishtha Roga Shosho Gudasthate. So again the etiological features and vitiated Vata specifically affects sigmoid colon, rectum and anus, that is Gudak Pradesha, which leads to retention of urine, feces and flatus, severe colicky pain, distension of abdomen due to flatus, various calculi and microcalculi, and many disorders which are attributed with pain but anatomically or structurally no abnormalities can be detected, and pain and emaciation of calf, thigh region, severe pain in lumbosacral, iliac and low back region. So here the Guda anatomically can be considered as, according to Chakrapani Acharya, Guda iti uttara gudaha. So sigmoid colon, rectum and anus, where mainly it is emphasized with apana vata vaigunya. Since Pakwashaya and Guda are completely equivalent to part of small intestines and large intestine, the treatments goes in a similar way. There is no different line of treatment which has been specifically explained for Gudagata Vata. Same line of treatment of Pakwashayagata Vata, that is Guda Pakwashaya Sthetu Karma Udavarta Nudhitam can be also applied here. So moving into last Ashayagata Vata, that is Indriyagata Vata. Here the vitiated Vata affects mainly the sense organs. So Shrotradishu Indriyavadham Kuriya Dushta Samiranaha. Mainly based on the Dana Sevana, again etiological factors, there will be vitiated Vata, and here it affects any of the sense organs and causes impairment of the sense organs. For example, I had taken, if there is Kavaigunya, that is a ear is an organ which is prone to get diseased, so there will be auditory sense organ. When Vata goes into it, there may be partial or complete loss of hearing, tinnitus and any other similar symptoms. So the chikitsa is Shrotradishu Prakupite Karyas Chanila Kamaha. So here mainly Vatahara chikitsa should be done, again Sneha, Sveda, Abhyanga, which has already been explained. To be very specific, in Karnagata Vata, one can plan for Karna Purana, that is medicated oil installation to ears. So here, complete Ashayagata Vata, whereas the vitiated Vata, which is getting either obstructed or deviating from its pathway, affecting the different organs and organ systems, have been emphasized like this. So I'll be ending today's presentation with Ashayagata Vata, a case study where we will usually forget this concept of Gata Vata in our clinical practice. So recently I had encountered a case which is diagnosed as Amashayagata Vata and treated accordingly. So the case goes like: a male subject aged 30 years who is not known case of hypertension, either diabetes mellitus or any systemic illness with no history of surgery or trauma approached my OPD with complaints of pain in chest and abdominal region associated with belching since 1 month. There is no contributory familial history or occupational history. General examinations were intact. Cardiovascular system, respiratory system, central nervous system, musculoskeletal, integument, urogenital were absolutely intact. GIT system, mouth, lips, and teeth were intact, whereas per abdomen, in inspection, there were no scar marks, stretch marks, visible veins, pulsations, and umbilicus was inverted. Auscultation, one bowel sound per 1 minute. There was no other any extra sounds. On palpation, tenderness elicited in epigastric region, umbilical, both left and right lumbar and iliac region, and there was no organomegaly. So we suspected there may be any structural differences and went on lab parameters, ECG, USG, and everything were absolutely normal. There was no structural involvement at all. So based on the signs and symptoms which has been mentioned under Amashayagata Vata, the case was diagnosed as Amashayagata Vata and treated accordingly. In Ashtasthana Pariksha, all were Prakrita with Jihvalipta and Agni was Manda. So to correct Agni, initially Deepana and Pachana line of treatment was planned with Shankavati, 2 TID before food for 15 days, and Dhanvantaravati, 1 TID before food with Jiraka Kashaya, 20 ml for 15 days. So after 15 days, the Agni was improved, Jihva was alipta, and pain and belching reduced up to 60%. Once the Agni is corrected, then the patient is taken for Shodhana. Mainly here, Kapha has been already brought to its normal state. Only the Vata which is moving around should be brought back to the normal state. So here Virechana was opted with Sukumara Gritha 30 ml in Arohana Matra up to 200 ml for 6 days, followed by Sarvanga Abhyanga with Dhanvantara Taila and Bashpasveda for 3 days, and Virechana with Avipattikara Churna 60 grams and honey quantity sufficient. So the total Vegas observed were 16 and Pittanta advised Samsarjana Krama for 5 days. And after Virechana, the patient was not having any pain or any belching symptoms. So first follow-up, Shankavati was given 1 BD before food for 15 days. There was no relapse of any signs and symptoms. And second and third follow-up after 30 days and 60 days with no medications, there were no relapse of any signs and symptoms. So I want to conclude today's session telling that always we forget a concept of Gatavata where functional disturbances in our human body are most evident nowadays because of faulty lifestyles, different kinds of food which is not actually attributed to your body system, and we always think in a different way, and structural impairment will be always thought upon first, then functional abnormality. So this new concept of Gatavata should make us to think in a different way where functional attributions or functional abnormalities should be treated based on licensed principles which has been told by our acharyas. Thank you. So the Gatavatas regarding Dhatugata Vata and Upadhathugata Vata will be taken in next session with the other case studies.
Yeah, well, thank you, Dr. Saujanya. That was an interesting session. Interestingly, moving on to part B or side B. So we'll be discussing those aspects of Gata Vata in the next session. So very interesting session, very interesting topic. Vata Vadis, how much ever we understand when it comes to clinical implications, it's really difficult. Most of us don't take the courage of going deep into whatever cases we get and diagnose them as Gata Vata or Avarana conditions. In such a perspective, these functional disturbances or imbalances of Vata in the form of Gata Vata and also the interference and interlocking mechanism of different kinds of Vata in the form of Avarana Vata, these should be well understood if we need to be very, very precise in the clinical practice. Many Ayurveda students have a hell of a time even remembering what are the symptoms of Gata Vata avasthas and also the Avarana conditions. So having said that, these sessions, I think, will be an eye opener or a mind opener. So cause the Srota Avroda clear so as to make the students think in a different perspective that the given case may not just be a Vata condition or a Pitta condition or a Kapha condition. We need to go beyond that cloud and try to explore. So what exactly is the condition? What different type of conditions a Vata disorder can present? Not going away from this context. So from that particular perspective and also the information perspective, so analytical perspective and also a case presentation towards the end. So that seems to be an interesting ending to the presentation, today's presentation by Dr. Saujanya. So thanks to Dr. Saujanya again for such a wonderful presentation. So throughout the length of our discussion, we'll be just going across those small elements of what we have discussed. How easy or how difficult it is, Dr. Saujanya, with a big grand experience also sitting in the clinics and diagnosing the Vata conditions. We have successful practitioners here. We have Honorable Madhav Digavi sir, Senior Professor sir here. We have Dr. Karim sir, Dr. Shivlila madam also. Sorry if I couldn't mention some. I don't have the entire list here because I'm on the screen. So seeing that, how easy or how difficult or how challenging these Gata Vata conditions are, and why do you think a physician need to venture into diagnosing these subtle conditions of Vata? Of course, from the treatment perspective, it is good. Why would a student not diagnose it as a simple Vata condition? So, because most of the conditions you explained is having a pain one at one or the other places, and most of the conditions also like Amashayagata Vata or Pakwashayagata Vata, whatever Koshtagata Vata, they're mimicking, they're almost approximate to a Shula condition or a Gulma condition. Why don't they make those simple diagnoses and make their life easy rather than going into the depth and exploring these conditions? What's your tips to the students?
So surely, Gulma is the first disease which come across our mind when we see, especially Ashayagata Vata, Lakshanas and signs and symptoms, and even the Chikitsa which has been explained there. But apart from that, Gulma have a specific pathophysiology and specific line to be attributed with, whereas Gatavatas are as simple as to be treated, which we usually forget when we sit in clinic, including me or many other physicians. We doesn't go with that depth of understanding the Gatavata or functional disturbances, but nowadays these are the most commonly felt out conditions, and treating that just by very simple Chikitsa Sutra which has been said rather than digging up into bigger diseases will help in finally treating a disease and getting results.
That's so nice and sweetly and shortly interpreted, Dr. Saujanya. It's very important. Yes, that is why we have the text. That is why we have Aptopadesha. So that's why we study so much. Otherwise, a BAMS degree would have been sufficient. We go and try to explore more things in our post graduations, PhDs, and the life doesn't end in exploring these things. And it takes a lifetime process. And also it puts a lot of effort, lot of energy, lot of experience there to understand these conditions. May take many years by the time we diagnose Amashayagata Vata. Yes, this is Amashayagata Vata and not a Shula, not a Gulma, not a Vatavedi, to come to that particular conclusion and to have an authentic declaration over our diagnosis, like diagnosis written in capital letters, block letters, and underlined or put in a box. It may take plenty of time, but yes, the effort should be there. We should try. And do you think, Dr. Saujanya, the Upashaya Anupashaya also comes into the way here? So because in these conditions, when we go through a traditional protocol or when the treatment is given in the known templates, so when we are giving the treatment and when the treatment fails, does that also act as an eye opener and change our direction and force to think, okay, this can be a Gata Vata Avastha, this can be an Avarna condition, and not just merely a Vata Vyadhi?
Sure, sir. Always Upashaya, Anupashaya, and Patya plays a vital role along with Chikitsa in case of Gatavatas. Many times we'll diagnose a condition, we will go with many investigative findings, and may at last sometimes we may end up with nothing, thinking everything is normal. Where exactly we missed that missing link can be a Gatavata back or the Avaranajanya Samprapti back. So that is very, very important in this conditions.
Putting it very short, we need to do many mistakes to come to a final, like to refine and retune ourselves that we have done something really good. And this is our pathway. We have done so many mistakes. One of the doctors, senior doctors, used to tell. So before writing a prescription, I used to take a lot of time, write the prescription, fold the paper, throw it to the bin, then write the prescription, throw it to the bin. So this practice made me perfect. So ultimately, I thought I should go with. I trained myself in writing a proper treatment protocol. So this takes a lot of effort. as you rightly said. So these are very interesting topics. So let's take a few questions from the question box before continuing our discussion. Arti Charanji has a question here. What is another Anupana that would be a good replacement? What is another Anupana that could be a good replacement if someone cannot consume ghee or any milk byproduct with Deepana Pachana?
Ushna Jala will be better.
Should be better. So Arti Charanji, I think that's the answer. The easiest Anupana or Sapana available is our Ushna Jala. So that can be used. Can we use it by default, Dr. Saujanya? So like in Vata Vyadhi, Ushna, something is not available, Ushna Jala can be by default. Or are there some conditions in Vata Vyadhi where we would look, no, 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 we are not going to use Ushna Jala here?
Uh, Especially when there is Pitta Vrita Vata and Raktagata Vata, we have to think twice or thrice before using Ushna Jala. Otherwise, whenever there is Kevala Vata or Kapha which is associated with it, or the Dhatu such as Mamsa, Maida, Majja and all, we can surely use Ushna Jala, sir. Because it have almost the antagonist property of Vata, which is Shita. Again, Kapha is Shita in nature, so that can be used.
That really makes sense for our participants who cannot understand this hardcore Ayurveda. I've been kept telling this Gurukula sessions or may not be like very much student friendly if you're not very familiar with Ayurveda, because we are going with many Ayurveda terminologies. We may not get this time to translate each and every word in the presentations, especially by our presenters. So those things, when the videos are available for you people, you can just go through those in a slow way. So just pause them and try to understand. Or if there are any doubts, you can post it in the group so that our experts can reply to those questions. Here, Dr. Saujanya mentioned hot water should be used with caution, seeing the Pitta Vrita and Rakta Vrita conditions. So here, Pitta Vrita condition, whenever we speak about that, will be an upcoming session by Dr. Saujanya, I suppose, awareness also. Here, the functions of Vata are impaired by Pitta or Rakta. So like we can consider the Rakta, that is the blood, or the Pitta, which are forming an outer shell, and the Vata is inside that particular shell. So like a small amount of air which has been trapped somewhere in the blood. Not exactly, I should not be using these words. So something of the sort, like there is an external layer, external coating, and there is something trapped inside. Vata is trapped inside by rakta, that is blood, or vitiated pitta. In these conditions, the hyperactivity of rakta and pitta will be more. In such conditions, if you give ushnodaka, that is hot beverages or hot water, if it is given, rakta, the blood is hot in nature, pitta is hot in nature, so it becomes like similar qualities. There may be chances that the things may worsen. So that is the case why. Correct me if I'm wrong, Dr. Saujanya. So
No,
these
sir,
are
you are absolutely right.
okay. So these are the conditions where we need to take a little bit of caution. Small thing, small detailing, but very effective in the clinical practices again. So Kalpana ji has a question here. When patient was suggested Shamana Chikitsa, was she suggested to keep her diet limited? I think this is related to the case presentation. When
Uh,
patient was suggested Shramana Chikitsa, was she suggested to keep her diet limited?
Diet was not limited as such. Only I had advised the patient not to consume Vatakara Ahara Vihara. I have made a list for that. And usually I'll be giving the list based on different conditions. We have different diet charts that has been given to monitor the Vatakara Ahara Vihara should not be taken. There was no limit in diet or no specific diet has been advised.
So that was an interesting case presentation as well. That added more interest towards understanding this particular topic. What made you, Dr. Saujanya, to like you made a differential diagnosis that it should be a Katavata Avastha, the case you presented, or directly when you check through the case details, you got no, this is a Katavata Avastha, or like you just screened out certain conditions and came to the conclusion.
Since I'm dealing with Vatavyada since 7 years from my PG days till now, probably that would have made me to think in a different way. Initially, the Gulma Samprapti striked into my mind, but I overruled the Gulma Samprapti and then ended with Amashayagata Vata when all the functional abnormalities were detected and structurally patient was absolutely normal and there was no psychological things involved in this condition. It was typically somatic that made me to diagnose this case as Amashayagata Vata. where probably in 100 in one Gatavata can be diagnosed, sir. Not exactly we can put it on conclusion.
That was quite awesome. Did you have students around when you diagnosed that? And did you get an opportunity to explain that? So that will be a passion of a teacher. Like while we are looking at that case, when we have students, okay, let's show the students so that students will remember that.
Yes, sir. Any interesting cases I'll be explaining to PG scholars and interns. So there were almost couple of three PGs and two interns, and there was a good discussion after few other patients. The same case came back, especially during the follow-up phase. The discussion went out really good, sir.
What would the basic intelligence have diagnosed that condition? It's not Katavata. You said one is Gulma. What other conditions would a basic intelligence of an Ayurveda graduate or a postgraduate make them think that this could be a diagnosis apart from the Gatavata and apart from the Gulma what you mentioned?
They'll directly think about Amla Pitta, which is very, very usual, very common. Similar signs and symptoms will be there. So if they literally dig up, they may end up with Udavarta because it's a condition which have again similar Samprapti and Shula, and at last Gulma, sir.
Okay, thanks there. And you kept mentioning Udavarta Hara Kriya also you have mentioned in one of your slides. Can you throw some light? What is this? Though you said it is a topic for future discussion, if you can throw light on the word Udavarta in brief so that our participants can understand.
So Udavarta is a functional condition or functional abnormality of the Vata dosha. So I had explained Panchavata in detail that Prana, Udana, Apana, Vyana, Samana. If any of this Vata leaves its pathway and goes in other pathways or opposite direction, then it is considered as Udavatta. For example, in brief, I'll take Apanavata. Here, the Apanavata Gati should be always downwards. If Apanavata moves in a downwards direction, then it is normal. If the same Vata starts moving in upward direction and causing diseases, it can be attributed to Udavarta as an example.
Thank you there, Dr. Sojana. That clears the things. Swapnaji's
Thank you, sir. Thank you, sir.
Question there. Thanks so much, Dr. Saujanya. So I'm curious to know different Ashayagata Vatas and suitable Deepana Pachana medicines. If you have time, could you please go over them today? Resources are also fine. Love to have Chikitsa Sutra discussion as well. Thanks again. I think the time may be a restraint. Would you give one or two tips here, or would we take it up in some other session, Dr. Saujanya?
So all the Gatavatas, it is quite difficult to plan Dipana Pachana right now. For one example can be taken as Amashayagata Vata, where directly Kshara has been emphasized as Dipana and Pachana, and same line I had adopted in my Chikitsa, that is Shankha Vati, where Shankha Basma is a Kshara Prayoga, again taken as Dipana and Pachana, can be an example for now. So rest of things can be taken up in future sessions.
Thank you. Thank you, Swapnaji, for that question. So your questions will definitely be answered in bits and parcels, may not be in this session. So we'll be taking them and exploring them in the future sessions. Yeah, so Gatavata, we are trying to explore and understand Dr. Sojanya. So like if we can put it in very simple words, so for all of us to understand what is Gata Vata? Gata Vata. So you have explained it beautifully through your slides. In simple terms, a layman's language, what is Gata Vata? Thinking that our average audience, all of us understand what is Vata, and Gata is some to go or to make its way into something. So how do we put this? And why is it as a different entity and a special entity in Vata disorders?
So to be very simplify the concept, Gatavatas are those where the vitiated Vata dosha lodges in specific organ or organ system or tissue, or it may be any other upadhatu such as vessels, connective tissue. So here the mainly concept of understanding the entire organ system, tissue and cell where their vitiation of the Vata taking place can be understood in a simpler way to understand what is Gatavata. And this is actually a left out topic in entire Vata Vyadhi, considering it as just a Gata Vata. Some technical or clinical explanation is not possible. Only a theoretical explanation has been given. Is a major misconcept of many physicians, because mainly nowadays we are encountering the functional abnormalities where entire Gatavata concept speaks upon that. So structural abnormalities are quite often easy to understand. Structurally there will be defect, we'll be correcting that. But functional aspects, without understanding the Gatavata concept, it is very difficult to treat. So that gives an importance to understand Gatavata in entire Vata Vyadhi.
Okay, thank you there, Dr. Sojanya. So we are still left out with part B of this particular session. After, I think, that session, so our participants would be understanding this particular concept thoroughly. So putting it other way, Dr. Sojanya. So Gatavata, can we consider it as a condition where uh, seeing through the minute components of vata, so like some qualities of vata. So because vata cannot be felt or seen, so it's an entity, so vata in the system. Like Gata Vata, we can understand when the symptoms of Vata, so like pertaining to the gunas. I'm just reaching out to the gunas of the Vata, the qualities of the Vata. Certain qualities of Vata go beyond balance in comparison to the other qualities and create some mess up in certain tissues or the organs. Okay, so can we take that condition like increase of Rukshata in certain tissue or increase of Chalaguna in certain tissue or an organ? So, or Karaguna. So, can we consider, so when certain qualities of Vata are abnormally presented or presented in an excessive way in particular tissues or the organs, can we take it as a Gata Vata, or is it wrong to do that?
It can be a part of Gatavata, surely, sir, because the clinical signs and symptoms which we see are surely attributed to both qualities and the functions of the Vata dosha there. Here, both will be hampered. So, the explanation can be 100% taken under Gatavata as a part of it.
Okay, so in treating Gatavata avasthas, are we trying to secure and protect that particular structure, like organ Amashaya, or Pakwashaya, or Mamsa, or whatever it is there? We're trying to protect that structure first. So, are we going to analyze what is the quantum of damage done by the Vata therein? Or do we first try to handle Vata that itself will take care of the damages occurring in the organs or the structures or the tissues where there is Gata Vata avastha?
So we have to handle this in two way. One is controlling the vatas. I can take an example. If we leave a bull outside in a farm, how it will destroy the entire farm. In a similar way, in our body, the symptomatology will be happening. So unless and until we doesn't control that bull, the damage doesn't stop. So first we have to control the bull, that is vata dosha should be controlled, and the damage which has been happened should be surely recorrected. Then only the complete treatment will be uh, thought upon. Otherwise, if we just control the vata and leave the organs as such, the damage will be there itself. So both should be handled accordingly.
Thank you there, Dr. Sujana. That gives a clarity and also makes good sense. We'll go to the next question by E. Ramdhani ji. Dr. Sojana, thank you. So, good reminder of the more detailed aspects of Vata's concepts. I look forward to more case studies to see how the principles of Vata is applicable to the management of the vitiated condition. Thank you once again. Yeah, there is a lot of eagerness to see through the cases. Dr. Sojanya will definitely share the cases when it is diagnosed in this particular perspective with us for a better understanding and better clarity. Thank you, Ramdhaniji. And Aarti Charanji, I appreciate the response. Thank you, doctors. Thank you, Aarti ji. Kalpana ji also has thanked. Dr. Padmavati ji, I think, has a question. Can you please share a few of these diet charts or any book that we can refer to in Vata Gata Vyadis? Diet charts or where to refer? So, where
So
to go
all
and refer?
the diet charts have been taken from our Samhitas itself, especially Brihatrayis. So you can refer Brihatrayis, and especially the Lagutrayis gives a different variety of diet chart, especially Bhaishajya Ratnavali is the main book where we can rely upon the diet. Even in one more session, one of our famous physicians has said the same reference. We'll be referring same Lagatrayis and Bruhatrayis. So the books can be referred and diet charts are made accordingly in our college. If possible, I'll share later on. Now it is not there with me.
Thank you. There, honest answer. I think Dr. Padmavati ji's question has been answered there. Sunitra ji comes with a question. Dr. Saujanya, can hypothyroidism be treated as Vata Roga, hypothyroidism?
So this will be very big discussion right now. Probably we can take that in some other sessions.
Sure. So thank you there. And still we have a couple of questions and 5 more minutes to wind up our session. But why Sukumara Gritha in the mentioned case? What is the logic there, Dr. Saujanya? In your case presentation, you have mentioned Sukumara Gritha was used
Sukumara Gritha
as Snehapana.
Yeah,
So
yeah.
my logic of that particular question is why was first of all Gritha made a choice? Why not Taila? If it is okay, Sukumara Gritha, we all know the properties of Sukumara Gritha. It is an extraordinary medicine. We can use it. And Sukumara, some people have an immediate gut reactivity. Many physicians don't use it for Snehapana because with one or first day or the second day itself, people have like motility after taking this particular Gritha, though the dosage was monitored in this particular condition. Was there any, to add up, was there any test dose given to the patient to see that the person doesn't have Virechana at the time of Snehapana itself?
So initially 30 ml was a test dose. As before Arohana Snehapana, we will decide the further doses based on first day's dose. So that was being taken and there was no reactions at all. Why not Thaila? Because patient was not that okay with Thaila Prayoga, so Gritha has been chosen. And why Sukumara Gritha specially, which have Erenda Thaila? Mainly here Vatanulomana is required and it is Amashaya where even Kapha should be taken care of. As I said, both bull and form should be taken care of. So Sukumara Gritha has been emphasized in this condition for Snehapana. And there was no any gut reactions or any other disturbances observed in patient.
So nice to know that Sukumara Gritha not available. So what should be the next plan?
Gandharva Hastadi Erenda Thaila will be one more best choice which can be opted here again, which acts on both Amashaya and Vata. That can be also taken into choice.
Thank you, Dr. Saujanya. Professor Madhudigaviji quotes a shloka here. Amashayagata Vate, Kapha Ashrite, Ruksha Purvo Hitasveda should be another option. Thank you, sir.
Thank you, sir.
Taken into consideration. And Kavita Koliji has a question, or is it not? Yeah. A patient with a lot of burping, I have done Udavarta treatment. Still burping is not gone completely. This should be considered as Amashayagata Vata. So that's a question. Should it be considered as Amashayagata Vata? She is physically well and no other disease apart from burping.
If there is pain along with burping, surely it can be considered as Amashayagata Vata. If it is alone burping, then we have to think in different ways also.
The reply, Kavitaji, so just check if there is pain. Pain is a predominant feature here in Amashayagata Vata. Else you need to check out for other conditions. So then, ma'am, can you explain Lavana Sneha? Is a question from Sandy.
So regarding Lavana Sneha, there is no direct explanation which has been given. But Dalhanacharya specifically says Lavana Sneha or Lavanottara Sneha can be considered as Sneha mixed with Lavana. So I had not tried in that aspect, so no much explanation regarding that.
Thank you, sir. Again, Madhudigavi sir opines differential diagnosis of Gata Vata and Avrutta Vata is a big debate. Definitely, definitely, sir. We would like to have Madhudigavi sir also on the platform. If ever we have a debate on these two topics, that will be a wonderful topic to discuss. Thank you, there, sir. Again, it's a big topic as well and a debatable topic, and it might not just end in 40 minutes or 1 hour. A valid point there. Pradnyaji asks, Doctor, what are the specific lakshanas need to look for Amashayagata Vata and Amla Pitta conditions? Like probably Pradnyaji is looking towards differential diagnosis here. What are specific nidanas? Do nidana parivarjana play a great role to normalize the condition?
Any disease, whether it is Amashayagata Vata, Amlapitta or anywhere, Nidana Parivarjana is a first line of treatment, so that plays an 100% vital role. So Amlapitta condition have a specific list of signs and symptoms which can be looked for, such as Amlodgara and other attributing factors that can be taken as differential diagnosis here.
Thank you, sir. Dr. Padmavati ji asks, Dr. Saujanya, many thanks for a wonderful session. I am looking for complete diet charts for Vatavadis. Diet charts are in full demand, Dr. Saujanya. Any
I'll
reference?
share it, sir, in group.
Yeah. Any references can be shared. Apologies, I need to drop off. Okay. Thank you, Dr. Padmavati ji. Again, some compliments coming in your way from Kalpana ji. So again, Madhudika sir has given a reference. Pratilomatva of Vata also seen in Amashayagata Vata. Yes. So again, Amashayagata Vata causes Pranavaha Sroto Mula involvement and Annavaha Sroto Mula and Udatavaha too. But Pratilomatva of Vata also seen in Amashayagata Vata. Thanks for your valid input, sir. So these things need to be considered. So the interlocking phenomenons and also the interferences and also mutual crossovers of the conditions beautifully explained by Madhudika sir here. Sukumara Gritha is Apana Kshetra Beshaja and it is Yamaka Sneha. Very, very good point, a valid point for our participants to note it. So Apana Kshetra Beshaja, so valid words used by Madhudika sir. So this is adding to our discussion. Apana Kshetra Beshaja, very important medicine which mainly acts on the seats of Apana Vata. So that needs to be considered, and it is a Yamaka Sneha. So Yamaka here, would you like to put put your opinion on this, Dr. Saujanya, for people who can't understand Yamaka? So because we have different combinations of Sneha. Sneha is here the medicated lipids, so Sarpir Majja Vasa Taila, so the either a ghee or oil or marrow or muscle fat, these are considered as different Snehas. So either we use them individually or use them in twos, threes, or all four mixed together. Yamaka, Dr. Saujanya, for people who can't understand this term.
Yamaka is a combination of two modes of oil, that is two modes of sneha. One is here mainly in Sukumara Gritha, ghee and Erenda Taila, that is oil and ghee. Both has been used in formation of Sukumara Gritha. So it is considered as Yamaka Sneha.
Thank you. Thank you there, Dr. Saujanya. So that's Yamaka Sneha. Twos, we mix twos. Trivrut, we have another word where we mix threes. And Mahasneha is a term used where we mix all four snehas and make it more stronger. So yeah, does it only contribute to the strength or is there more to that, Dr. Saujanya? So like mixing up two, how do we decide which to mix and which not?
So Sukumara Gritha is already explained Gritha which has having the Yamaka Sneha.
No, apart from Sukumara Gritha, any Yamakas we are taking, what is the logic? So where do I decide Sarpi plus Taila or Sarpi plus Majja or Taila plus Vasa to mix over these things? Okay, we'll take up. So I think I should not be misleading this discussion. This may be a topic at again in some other discussion. So we'll keep it on hold. Madhudika sir again mentions many modern drugs are sodium based. Lavana Sneha is area to think pharmacodynamics of Gruta Kalpanas with Lavana as one ingredients also. Thanks again, sir. Lot of notes here for Ayurveda students to make it over and to analyze things in a different way. These add definitely value add and also give perspectives to our discussion. And one more thing, Dr. Saujanya, Pakwashayagata Vata, you mentioned Udavarta Hari Kriya there. So why this such crossover treatments might be mentioned in the discussion of any disease? Like in Pakwashayagata Vata, we are considering the Udavarta Chikitsa. Is it because the pathologies or pathogenesis or the sampraptis are proximate, very close, or there are almost the symptomatology is almost the same, or the treatments can be like interchanged for each conditions? That does it also mean to tell that in Udavarta we can give Pakwashayagata Vata conditions, or we should be seeing them as very closely compared conditions of differential diagnosis? And one more question to add to this: are they mutual causal? Like a Pakwashayagata Vata can cause a Udavarta, or a Udavarta can lead to Pakwashayagata Vata. So this intersection of pathogenesis also may be there.
So mainly here the same line of treatment has been explained because both of the conditions Apana Sthana and Apana Vata is the main culprit what is going on here. Even in Pakwashayagata Vata, Gudagata Vata and Udavarta, probably the pathophysiologists which are moving have a same pathophysiology in means of Apana Vata where the Vata Gati has been hampered which has to move downwards is starting moving upwards. So probably the line of treatment which has been explained for a condition called as Udavarta has been emphasized here also. And 100% for differential diagnosis, usually we doesn't take the conditions where functional abnormalities has been taken such as Udavarta or Gata Vata. We can be thought in that way also.
Okay, so that's a logical explanation. So and a good one too. So we'll take that, Dr. Sojana. Thank you for that reply. And ma'am, why Avipattikara Churna was selected for Virechana in this case? In the case which you presented, Sandyji's question.
So mainly here Amashaya is Agnisthana, so that has been considered, and the patient was needed a Anulomana rather than Rechana or Bhedana or Sramsana, so Avipattikara Churna has been selected instead of other drugs.
Thank you there, Sojana. So one more thing, so right in the selection, in Koshtagata Vata, Dr. Sojanya. So the last question, Kshara or Kshira? So you mentioned Kshara and Kshira both. In which condition should Kshara be taken? And in though there was a difference of opinion, like I think Bhav Prakash mentioned mentioning Kshira. Okay, so if we need to consider both, so where do we give Kshara and where do we give Kshira? So any demarcating line there in Koshtagata Vata?
So especially in Koshtagata Vata where Pitta dosha has been involved along with Vata dosha, Deepana Kshirapana can be planned instead of Kshara because again it causes Pitta Prakopa there. And wherever there is Kapha dominant along with Vata dosha, surely Kshara Prayoga can be opt upon.
Until we meet next time in Gurukula episode 29. Thanks, namaste, and lots of love to all of you from Easy Ayurveda. Namaste.